Infertility can begin with a question and then grow into a difficult struggle. For many, infertility will rock them to the core. A journey marked by uncertainty, frustration, sometimes limited options. A new frontier is emerging, and that is regenerative medicine. It's offering hope by tapping into the body's own healing power to restore reproductive health naturally. To share about cutting-edge biologics that are reshaping the landscape of infertility treatment, I'm joined by EmCyte's Dr. Beata Tralik and Sina Farzaneh. So, what are the most common causes of fertility issues?
That's a very good question, and it's an important question because this problem is growing.
And there's still natural therapies out there for helping women get pregnant.
Thank God.
Yes, yes.
Thank God people still get pregnant on their own.
Yes.
But unfortunately, fertility is a growing issue right now.
Do you have a hunch on what's root cause is, other than high BMI?
Very good question. And if we knew all answers, we would be able to make everyone pregnant.
Yes.
But
feels like a lot of it is choosing to get pregnant at an older age.
That's one of the issues. So what we see, and it's amazing that the women right now want to first finish college, be independent financially,
yes,
professionally, and don't get me wrong, it's amazing. But unfortunately, we very often see patients coming, I don't want to say too late, but sometimes it's very late. And then to the point that we see patients who are 45, 46, still not ready to be pregnant, but they want to freeze the eggs when we have nothing left to be frozen. So those patients should be thinking about freezing the eggs maybe 10 years earlier.
What intervention particularly excites you the most?
We started using PRP back in 2018. It was a young patient with very good quality frozen embryos, and to our big surprise had very, very thin lining in her uterine cavity. Nice, good, thick lining plays essential role in successful implantation. So to our big surprise, this patient was not ready. We tried multiple interventions, multiple changes, different protocols, different route of meds administration. Prayers also didn't work well. And I started doing some research what else we can do for this patient, and I came across PRP as an option.
I see.
As you know, in the literature, we have now evidence about the PRP and its power for regenerative medicine, for mostly regeneration and also subsidizing the inflammation in I would say over 30 different specialties and subspecialties.
PRP we're using short for platelet-rich plasma and as pro-growth factors.
Yes.
Both. What is it about this platelets? Is it more platelets, less platelets, different types of platelets?
Definitely it influences different formulation of the platelet, different characterization of the platelet. So,
and EmCyte does that. EmCyte has a way of getting which type you need.
Yeah. So based on the combination of the different cellular component of the PRP and different concentration of them, we could get the benefit of the regeneration or anti-inflammation.
Does the stem cell figure into this therapy as well, or you're not doing that with what you're looking for?
We are not doing this
just
yet.
PRP.
It's probably
just
future,
PRP,
but we are right now want to be focused on the PRP and then to standardize and optimize. But by doing the research, I had pile of articles about PRP on my desk. And then towards the end of 2019, I said, okay, let's go back to the topic. And with Dr. Alon, who's president of my clinic, we sat down and said, let's try. Because I think it's excellent option for many of our patients. We just have to be better prepared.
And this is people, primarily I'm guessing you're using it for people with embryos who need an enriched uterine environment.
So we play with two organs, ovaries and uterus.
Okay, what are you doing for the ovaries?
We rejuvenate them. And then we have patients who are poor responders. So they maybe have good ovarian reserve, but they don't respond to medications well, and then sometimes we have to cancel cycle. Or patients who failed IVF, meaning that she responded, we retrieve the eggs, but we are not able to freeze the embryos because of the quality of the egg.
How do you get the PRP into the ovary?
How we do it? With the needle.
Is it right into the ovary? Directly into the organ. And then the uterus, you sort of suffuse it, right?
Yes, it's infusion.
Interesting. What's the future hold for fertility treatment?
Definitely we are very optimistic about the future because we are in the first step in reproductive medicine using the regenerative biologics, specifically PRP.
You seem enthusiastic about these interventions.
Yes.
And you're doing something that's working.
Yes, we definitely, and we see huge improvement in the patients with recurrent implantation failure. This is the big deal. Yes, we are able to help
so healthy embryos can't implant.
Yeah, and it's very frustrating when we have young patient with very good quality frozen embryos and she fails multiple embryo transfers. And embryos are genetically tested. And then here we have seen improvement by around 60%. It's a lot.
That's a lot.
But we would like to help also other 40%.
Thank you guys for being here, bringing us this interesting story about the biologics. And if you'd like to explore more about these advanced therapies, head to emcyte.com, emcyte.com. Don't go away, we've got more ahead.